Appreciate you. Anyone else want to come off and introduce themselves before we get started today? Imani, Isaiah.
Sure. My name's Imani. I'm a second-year medical student at Brown University in Rhode Island. Thank you for having this.
Of course, thanks for joining. Let's keep it
What's
rolling.
up, y'all? What's up, y'all? My name is Isaiah. I'm in Los Angeles at Charles Drew University, first-year med student and interested in ortho.
I love it. Appreciate that,
Hello,
Isaiah.
everybody. My name is Juan Diego. I'm currently in MD and PH program, so I'm doing my MPH first. I'm at Upstate University, and I'm interested in ortho.
I love it.
Good night, everyone. My name is Claude. I'm currently a first-year medical student here at Sidney Kimmel Medical College in Philadelphia, and I'm also interested in orthopedics.
Awesome. Thanks, Claude.
I also forgot to mention that I was a 2024 Nth Dimension summer intern in orthopedics. So.
Love it. Love to hear that.
Hi, I'm Aaliyah. I'm the oddball. I'm actually a non-traditional student taking coursework prerequisites for medical school. My mentor actually told me about this meeting, and so I've worked as an orthotech for a few years, and I decided from those experiences that I wanted to become an orthopedic surgeon, so that's why I'm here.
Love that. Thank you for sharing.
Hi, everyone. Can you all hear me?
Yes, we can, Derek.
Okay. Hi, my name is Derek Abdomenu. I'm a first-year medical student at Charles Drew, together with Isaiah, and I'm interested in orthopedics.
Love it. As you should be, right? Who else we got? All right. We'll give it a couple more intros and then we'll get kicked off today if anyone wants to come off, or else we'll get started. Hey, you'll learn it's all about networking. Make sure your name's known and you're stepping out of your comfort zone and putting yourself in a good position. So it starts today. Anyone wants to come off and introduce themselves before we get started, feel free to do so. We'll give it about 30 more seconds before we kick it off.
Hi, my name is Michelle. I'm a medical student at All Saints University, Dominica.
Perfect.
Final year med student.
Thank you, Michelle. All right, 10-second countdown. All right, so appreciate everyone being on today. We're gonna have a action-packed session here. We have great panelists here to share a little bit more about their experience. And honestly, this whole session is about you all. That's why we're here. We're here to support you and give you the resources, the education, the network, the mentorship that you all need to position yourself for success. You're all in an amazing spot with a lot of work ahead of you. So we're here to support and do what we can to prepare you for success during this long journey. So we're gonna kick off with introductions from the panelists, and we're gonna pose a couple questions, but honestly, we want this to be super interactive. If you all have anything that's on your mind that you want to cover today, come off and share, because this is about you, like I said. So we want to make sure you all walk away with some valuable nuggets and tips that you can implement today to set yourself up for success moving forward. So I'm going to introduce myself first as the moderator. My name is Rasan Stewart. I'm a member of Zimmer Biomet's Health Equity Division, which is a newer division that kicked off last year. And our focus is on increasing access to healthcare within underserved communities and communities that we all represent on this call, and also partnering with institutions, academic institutions, community hospitals around health equity education, right? So if any of you all are at medical schools, your residency programs, your fellowship programs, or even when you're practicing and want support from Zimmer Biomet from a med ed perspective, so cadaver labs, bioskills labs, journal clubs, I'm your person to speak to. So I'll definitely be sharing my information after this, and I look forward to keeping in touch with you all throughout your journey. So today we have a great panel. And I'm not going to do it justice introducing them. So I'm going to briefly introduce them and then give them the opportunity to share a little bit more about their journey to date. But we have Dr. Pierce, Dr. Ibe, and Dr. Howard on the call, who are all going to be our main panelists for today, sharing their insights and answering questions that you guys have, about your journeys and sort of what your future looks like. So give a round of applause and thank them for being here. And I'll pass it over. We'll start with Dr. Pierce. Do you mind just walking us through sort of your journey to date to give the group an understanding of sort of your path?
No, absolutely. My name is Todd Pierce. I'm originally from the Washington, D.C. area, so if I'm depressed during football season, you know why. I went to GW for medical school, so Washingtonian through and through. My path to orthopedics was certainly not a straight line. I applied right out of med school. I didn't match. I applied after doing a prelim year in gen surg, didn't match. And then I did a bunch of research, publications, podiums, posters, you name it, and then I matched. And then not only did I match, then I ended up doing my fellowship at Baylor University in joint replacement. I'll be joining faculty at Medical University of South Carolina, their Florence office community, in their Florence community. I'll be starting their joints program there and probably their robotics program. So I certainly know about what it takes to do this. I know what worked, what didn't work. I know what to do to encourage yourself when you feel like things just aren't working. So definitely glad to be here.
Awesome. Thank you, Dr. Pierce. Dr. Ibe, do you mind introducing yourself briefly for the group?
I don't mind at all. Thank you all for being here. I think this is huge. I try to do as much of these as I can because when I was going through the process, when I was where you guys were, there wasn't a lot of information. It seems like a long time ago, 15 years now, but I think taking advantage of these moments, making sure you're writing notes and remembering things, it goes a long way because this is sort of an arduous process. So, of my path, currently my position, I'm the residency program director at the University of Mississippi Orthopedics Department. I did a fellowship in oncology prior to that, and then my residency was at Yale New Haven Hospital. I did medical school in New York. I think I was very fortunate along the path. I had a lot of things that worked out for me, and try to make sure I share some of that, impart some knowledge.
Awesome. Thank you so much, Dr. Ibe. You have Dr. Howard to wrap us up, and then we'll get into questions for today.
What's going on, y'all? So my name is Roland. Grew up in Jersey originally. Did college and med school at Rutgers. Although I don't talk about it a lot, I think Michelle or someone else said that she's in Dominique or somewhere else. I also had a kind of circuitous, non-traditional path in that I started off at St. George's University initially for med school prior to transferring back to Rutgers to complete med school. Did my residency out in San Diego in California, and then came back to the East Coast for fellowship at Rothman for sports. And getting ready to start my attending job in a week and a half now, staying local in Pennsylvania. Looking forward to talking to you guys.
Congrats on that. So now that we have an understanding of, everyone on the call introduce themselves, we have an understanding of the panel. I honestly want to make this as applicable and relevant as possible. So I'd love to hear if you had, to choose 2 or 3 things that you wanted to walk away with from this session, what would that be? Is there any topics or questions that you all have that you want to focus on right off the bat? Feel free to come off, throw it in the chat. I'd love to hear from you all. Okay, we have Isaiah saying research in the chat. What else we have?
Similar with the research and how, I guess it's importance. Dr. Pierce, you had mentioned your journey in not matching more than once and then doing research that, I don't know if that helped you match or not, but sort of its weight in your application as a resident.
Okay, so double down on research and how that's, what impact that plays. Juan?
I would say, what do you think are the 3 most important things for us to focus during medical school that could make us also more competitive for residency programs but also not losing focus on medical school?
Love that. So we have double down on research, and then 1 question around what are the top 3 most important things you can do to position yourself for success. Perfect. Isaiah?
Yeah, so I guess doubling down again on the research component. So like for us being M1s, you know, we get a lot of advice, especially CDU being a new university or medical college. A lot of people are coming in giving us their perspective. One conflicting thing that we're hearing is get your feet wet with medical school, get things rolling before you get into research, and then other people will come in the next day saying, if you want to do ortho, you gotta get like down and dirty with the research right now, get into it right away. So I kind of want to just hear some thoughts on that as well, you know, starting early basically.
So love that. So timeline, when's the right time to get involved in research? Definitely love these thoughts. So it seems like research is a hot topic. So why beat around the bush? Let's get right into it. For the panelists, I'd love for anyone to come off and share their opinion. How has, you know, what role does research play within the success of, you know, transitioning, getting through med school, having success in residency, and ultimately getting to where you are in your roles?
To be clear, because I mean, I'm no stranger to research. I have over 70 publications. I have multiple podiums, multiple posters. So so if you so r good research cannot replace the core stuff, the doing well in the clerkships, taking care of business on our USMLEs, the having good mentor. It cannot substitute those things. It is a part of a basket of things that has to make you stand out from people. Can make you stand out from people though. The biggest thing about research is a lot of people will go through research summers. They will do research years. They will take this time off and they have not one publication to show for it. That to me is just, it just can't happen. In my mind, when you enter into any period of time doing research, it has to be carried to completion. It shows programs your ability to see something from the rooter to the tutor, if you will. So that ability to kind of see things through is critical. And what research does is it gives you something to talk about on your interviews as well. Because now, having said that, if you put something on your application and you said, oh, I got a paper out of this, and you can't talk about it, you're in trouble. Anything on that application can and will be used against you. So know thoroughly that piece of things. So anytime taken off for research, bottom line, has to yield something. It has to yield something. Poster, podium, publication, something that you can show for it, like concrete.
Awesome. I love that. And before we push forward, I just want to give context to anyone who just joined. I posed a question to the group. What's top of mind? What do you want to walk away from today's session with? What understanding do you want to have? And a lot of questions came around research. So Dr. Pierce just emphasized the importance of doing research is great, but having something to show for it and being able to speak to it is just as important and just having some involvement in research. Also wanting to move on before I pass it to Dr. Ibe, Dr. Howard. I also want to introduce J.R. Smith, who just joined the call, who's also a part of the panel. And I'd love for him to come on and introduce himself, tell a little bit about his background before we keep pushing forward.
Hi, all. Sorry for being late. I'm an intern at the Mayo Clinic, and doing intern things had me kind of trying to hustle back and get on this panel. But it's an honor to be with you all. Went to med school at Mayo. Like I said, I'm an intern right now at the Mayo Clinic. Very, very passionate about trying to improve and increase diversity in the space of orthopedics. And it's great to see faces like this. Great to meet the rest of the panel, and great to see you, Dr. Ibe, again. I know I see you pretty frequently, but honored to be a part of this. And thank you so much, Rasan, for letting me join this panel.
No, of course. Appreciate you being here. I know we had a few people trickle on too as well. Before we keep pushing around the research topic, we opened up the room for anyone who wants to come off and introduce themselves to the panel, right? It's important to build a network, being comfortable coming off and introducing yourself and commanding the room. So if you want to, feel free to come off and introduce yourself. I'll open it up for 30 seconds before we keep moving forward.
Well, there.
Who my camera is, but can you guys hear me?
Yes, we can.
Yes. My name is Paulie Kawabagirika. I'm a first year med student at Thomas Jefferson. One of my colleagues is here, Claude, who's also a first year, and he shared this invite with me. So thank you guys so much.
Awesome. Thanks for coming on.
Yeah. Just to piggyback on what Dr. Pierce said, really, it's really up to what you can handle, right? So if you're someone who that transition period into medical school, that first 1 or 2 years, you need the time to dedicate towards studying. You should not be putting that time towards a bunch of research that will take away from your grades in your courses, right? So right now, when you look at the way the system is, you don't have a step 1 score anymore. So most places look at your course grades and how you've performed in first and second year, sometimes your clerkships, and then your step 2 score. And so you really want to make sure that your grades are well. What I would prioritize slightly more than research as an early student is spending time around the department, around the residents. Especially if you have a home program, those residents need to know who you are. They should never say who's applying to orthopedics in a couple of years and your name doesn't come up, right? And so you need to be present, right? You don't have to be active in research. Like that's, if it's not your thing, but being present will get you opportunities. Showing up to grand rounds. When are the resident lecturers? Can you come there? Can you shadow not just the faculty? Can you spend time with the residents? All these things sort of make a difference, and they're easier to do than, say, hopping on a project, trying to get an IRB through. I mean, that's going to take a full year of your time, getting a manuscript published, right? So Todd had to do a year of research to get all that stuff, right? So it takes time to get that. So it's easier to do these other things.
That's great
I would
advice.
echo what everyone just said. The thing I would add, though, is that you shouldn't be discouraged by the numbers. I think when I was applying, which seems like forever ago now, it was something like every matriculant into an orthopedic residency had at least 5 publications. It's not a standard distribution for those averages. So you have people like Dr. Pierce who published 75 articles or whatever over the time that he had. I'm not sure if it was just before residency or including residency as well, but those people tend to skew the numbers a little bit higher. So there are certainly people who don't have many publications, if at all, who do successfully match. That being said, the goal should be to have everything, have both a stellar clerkship scores, a step 2 score, and research. But just wanted to put that out there just so that you know, because when you see those numbers, sometimes it could be a little bit discouraging, especially if you're not coming from an institution that has a history of high publication volume.
I love that. Two great, feedback and, advice towards the value of research and when to focus on it, when not to focus on it, and the priorities when it comes to all the other things that you have on your plate. JR, do you want to add anything regarding research before we push forward?
Yeah, I'll add one point that I think ties in with what Dr. Howard just mentioned. I think that people will perceive your research production different based on where you do go to medical school. And so for people who do not have home programs and tons of opportunities like that, comparing yourself to someone who is going at these big academic centers is only going to kind of cause you to spiral, and that and it's not a fair comparison, and it's something that programs recognize as well. But if you are coming from a program that is a big academic center that students historically are able to publish a lot from, you should make sure that you also kind of try to check that box as well, because the expectation from you is going to be a bit different. There's a lot of organizations now, like Nth Dimensions and things like that, that allow some students like without home programs to get involved with other academic centers. I know like Mayo hosts and students, for example, and a lot of research is kind of funneled to students who don't have those opportunities elsewhere. So look for those kind of opportunities because they're out there, and we can talk more about those, outside of this. But I think it is just, I think what Dr. Howard mentioned, the expectation could be a little bit different. So I think that's just one point I would add.
Yeah, that's awesome, right? There's no one size fits all. The situations vary. I know we have a question from Claude up, so feel free to come off.
Yes, on the topic of research, in the event that someone might be coming into medical school, having done a year of research previously, do you recommend that they continue to do research, especially if they are at an institution where, like JR mentioned, there is a lot of opportunity to do research? I only ask because I have had the privilege to speak to some doctors that are involved in, I guess, the admission process or of residency applications, and something they mentioned to me was this idea that you don't want to be a one-trick pony, I guess, so to speak, or like. So I guess my question is there a number that you think there's like too much research where, maybe it might come off as, red flag for some programs?
The only way I could say that a research could come off as a red flag is if you have 50 million publications and you are on academic probation. If you didn't prioritize the core things like we mentioned, that's the only thing. And you have those publications that shows a lack of prioritization to a program. That's the only reason in my mind, I would think. I don't know, Dr. Ibe, as a program director, if you would have. There's some other thoughts you might have there, but my thought would be if I had met someone in that regard, I would the only thing that would concern me is if they had publications without the academic, baselines that we look for.
Just to chime in here, I mean, I wouldn't say there is such a thing as having too much. I don't know how many someone might have, but there's always someone with more. Like, they've been very impressive applicants that have gone into orthopedics over the years. And so it's not necessarily about the number, but you need to be able to speak to in pretty much good detail about your research. So if you say you did 30 projects or 40 projects, and people can ask you significantly into detail about what exactly are you doing? What did you do? How did you get here? What did you find? Right? What was the process like submitting? They can ask you anything about that. So if you don't understand really what that research process was, it really would be a detriment to you to add that, if that makes sense. So that I don't think there's such a thing as having too much, except if you're not knowledgeable.
Agree on that. And then the one thing I would add is that I do think it's important to continue though. So I've heard it a couple of times now, having sat on kind of admissions committees and then just hearing attending speak about it. One of the things when it comes time to review applicants, there are so many people who are applying that are stellar, like across the board. So you have to start like really splitting hairs about how you're judging different people. And something I have heard come up is this person has research publications, but they did them all over 5 years ago. So it's kind of like they did what it took to get to one step in life and then they kind of fell off. So it's important that you have them already and you'd be ahead of the game, because part of the game is even just having the prerequisite so that you clear the filters when it comes time for applications. But at times, if you're applying to certain programs, they may try to look at like how are we going to try to sift through these applications, and something as small and minute as that can make a difference. I think that's a very small thing, so it's not crucial, but it's just something to keep in mind. I think people like to see that you have, if anything, an upward trajectory and that you continue on that pattern of success and achievement that you had in the past.
Yeah, I had a similar story to you, Claude, because I did a year of research before starting medical school. And I had got the exact same advice that we've heard. And I think the advice that I got was the reason why you want to continue is also because research for a lot of people is a way for you to demonstrate like productivity and just like as just a general thing, not just like research productivity, but being like a productive medical student. And for you to be able to do research when you're only doing research is one thing, but to be able to do research while you are also excelling academically, kind of demonstrate something else. So going from, 100 to 0 when you get busy would kind of potentially show that you're unable to be productive and handle the rigors of having to balance a lot of things in residency.
Awesome. Great advice on research. I know Juan has one question, and then we'll push forward and address some of the other questions that we have.
Yeah, thank you. My question is about, does the research have to be related to like orthopedics, or because right now, like I'm doing research for my MPH and it's definitely not related to orthopedics, but
Yeah,
would this be seen like a red flag, or?
Yeah, so I wouldn't say that having a majority of your research be in fields other than orthopedics is a detriment. It's a drawback. Again, as long as you're able to speak to that now, if you have a bunch of research in other fields and you have 0 on orthopedics, that's a red flag, right? So if you've shown that you understand the research processes, you should get involved in some orthopedic research, right? So if you've already shown that you have that prowess, you have to show something in orthopedics, because you're essentially applying for an orthopedic job. And so you have to show, okay, well, here are things that show you and show others that you are interested in orthopedics. And so it's okay to have publications. And we have people apply all the time. They were thinking urology for years and switched. It doesn't matter. But when they switch, you get on orthopedic projects. And so you say, okay, well, my actual projects into publication are here, but I actually have ongoing projects with Dr. Blank, talking about total joint arthroplasty and infection rates, and speak eloquently about it. People say, oh yeah, that's perfect, right? That's what I would say for
that. I would echo those feelings, that if you have research outside orthopedics, that's completely fine. But if you didn't have anything within it, that would be, and you were prolific in other areas, I would ask why. Why? You love orthopedics, right? You want to live in the hospital for 5 years and do all this fun stuff, and you didn't get involved in any orthopedics. Why not? So, and the other side of that too is that when you do have orthopedic research and you know it well, it does give you something to discuss. I can't tell you how many times when I would go on interviews and some of the papers, they would say like, hey, Todd, I saw that paper you wrote about, you remember the paper you wrote about, like, the survivorships in HIV patients with, who got total knee arthroplasty? You said there was no decrease. So what else did you find in that paper? Some people really do have interests there. So it really does bring a topic of conversation, particularly if it's something that your interviewer is very interested in. And that's just, don't lose that advantage.
Awesome. So there's, we spent a good, 20 minutes, 15 minutes discussing research. I'd love to broaden the topic and speak. I know there was a topic earlier around what are the 3 most important things to focus on to position yourself for success. I'd love to hear from the panel to just share a little bit of their insights, some things that they wish they knew, some things that they'd love to share with the group, before we push forward. JR, do you mind kicking us off?
Yeah, sorry, Rasan. I was responding to this message in the chat from Isaiah. Can you repeat that question, and then I'll respond to this message as well.
Sorry, I didn't even notice the question in there from Isaiah, so I appreciate you responding to that.
Oh, absolutely.
So prior to kicking off, we had someone come off and ask, what are the top 3 most important things that the group should be focusing on to position themselves for success. So just wanted to open it up to the panel to share, some insights that they wish they might have known in their shoes.
I think for me, like the thing that I ended up recognizing was the most valuable tool to my success, like matching in ortho, was networking. It's getting like, I think this year, I think it was like 60% match rate or something like that. So it's incredibly competitive, and almost everyone is going to have the baseline things that we're talking about with the good clerkship grades, the good step scores, you know, the handful of research publications, you know, like enough to be able to check the box saying that you were productive. And so what I recognized is that the connections that I made with residents, like, you know, I think Dr. Ibe mentioned earlier, like, or Dr. Pierre, someone like at my institution, like that helped because then they connected me with residents when I did my away rotations and residents at places that I interviewed with, and being able to walk into a different environment, whether it's an away rotation or an interview, and have somebody who I've already connected with feel like they're already kind of on my side and already wanting me to win is a very different experience than kind of walking in and just being another applicant. And so those things played, I think, a critical role for me to be able to actually, I don't know, perform in a setting where I felt like people wanted me to win. And that for me, I think was like if everyone's coming in with the same paper application, having support from other people is oftentimes the thing that's going to kind of like push you over the edge into kind of succeeding, and that carries over into the attendings and, you know, faculty that you connect with too, and the amount of discussion that goes between, you know, mentors and program directors and, you know, faculty between programs. Ortho is like a small world, and people were telling me that when I was in med school, and I was like, oh, there's no way everybody's ortho, because like, you know, everyone I look at is ortho. But these faculty from all across the country, like they know each other very well. They go to the same conferences. They love going to these conferences because it's opportunities for them to hang out with their, you know, friends, colleagues, people they went to med school, residency with, all those kind of things. And I don't think that people appreciate enough how impactful it is to have somebody that you are already close with as a co-faculty at a different organization say that this student who is my mentee is one of one. They are going to come to your program and crush it. They really want to go there. You know, just hearing that from, you know, if like from a co-medical student, if I'm like a faculty somewhere and I hear that from a friend, that's going to carry probably more weight than a lot of the things that I see on a paper application, just because I trust who it's coming from so much. And so I think that some students do themselves a disservice by just kind of, you know, keeping their head down and focusing on like the, you know, all the things that matter, right? But like not taking into account how important networking and connecting with other people are. And so that's one. I know you asked for 3, Rasan, but I've been probably chatting for too long with that one. So I have a couple more, but I can definitely open it up too for Dr. Pierce, Dr. Ibe, and Dr. Howard.
Yeah, I think what you said is huge, and this will tie into what Isaiah's question is. So if you're at a home program that does not have orthopedics, you're slightly behind on the 8 ball. A lot of those medical schools are primarily dedicated towards getting people to do more primary care focused than orthopedics subspecialties. And so it's not impossible, but it's slightly more difficult. And so one of the ways that I've seen this be remedied is, well, what's the nearest program to you? So if you have a program nearby that's easy to reach, trying to figure out how you can develop relationships there and get to know those people, because it's a two-way street. Not only do you want to show people that you have interest in orthopedics, you really want to identify if it is a career for you. It's very difficult, extremely, right? JR would tell you he's in his first couple of months, right? It's extremely difficult, and you need to see what the life is like before you make that commitment. The life of the residents, the life of the faculty. Is it something that you want for yourself long term? And that's why it's very important to have that exposure. So if you don't have a home program, I would start by identifying what is the closest program to you and how can you be involved with them.
That's awesome. Dr. Howard, Dr. Pierce, anything on? I know we have Amani with a question as well. Feel free to come off mute and share.
No, I was actually just replying to Isaiah also, and then 2 different people kind of addressed it. So the initial question was what the best ways to make sure you're competitive, or
Yeah, just pieces of advice, yeah, to set yourself up for success.
I think I mean everything that was said obviously goes a long way. For me, I think you want to go into the application process knowing that you objectively are on paper as good as anyone else. And what that comes down to for me, what I recommend is the most important thing just being step two. Is step one in the past, but now step two, research, which we already addressed. And then number three, it can be multiple different things, whether it be networking, which we've already kind of spoken about a little bit, your letters of recommendation, the caliber of your med school kind of ties in a little bit. But those first two things I think are crucial. What it really comes down to is people have to review so many different applicants, and they are looking for any single way to try to make their life easier. So if you at least can make sure you're not closing doors on yourself by not having a score that's, at least, on par with the remainder of the applications, I think that you're going to help yourself out a lot. So I would say when it comes time to take that step two, just make sure you guys do as much as possible that you crush that test. And we spoke about research, so you kind of already know what to do there. And then just make sure you do all your clerkships as well. So that's just three different things I think go a long way towards matching.
My question was along the lines of networking with your home institution. I found that I did Nth Dimensions this summer, and they put me in a really diverse environment in Texas. And coming back to where I am now, the orthopedics department is not as diverse for people who maybe came from a more like homogenous area. Like, how did you best find ways to fit in with your like resident populations? Because I just find myself like being always the oddball, and it's very uncomfortable, which I'm okay with, but
there was always, like, for example, I went to GW, and so GW, I think in their entire history has taken one Black resident. So when I actually reached out as a first year to faculty. So what I did was, the way I started my networking as a first year is I looked at the faculty list of orthopedics, and I just started emailing people. And the first people to get back to me said they wanted to meet me were the ones who became my mentors. Through that, I met one of my greatest mentors, who's also a big fan of the Nth Dimensions, Laura Tosi at Children's National, who let me know about something called Nth Dimensions and the Gladden Society, which I didn't know existed because my other attendings didn't. So, because speaking to the point of ortho being a small world, just from those emails I sent out, that started my connections. That was the beginning of it. And then as time went on, I was going to the conferences. I was collecting business cards. I still have a stack of them in my book bag, to people I still keep in touch with to this day. That really does go a long way because ortho is a small world, we talk, and and that's the first thing I would do. Like I started just by I just shot my shot, with different faculty, and the ones who responded, and it was like, oh, how are you? They're actually interested in trying to help a student. The first guy I met, he even said, "It's good you came to me as a first year. I have so many people who come to me and they're third and fourth years, and by then they've already done all their clerkships. They haven't done research. We haven't talked about where to go aways, and like, we can't help, So starting early is the very best thing to do in terms of, trying to put your feelers out there, because someone, but just because by very nature we like when people want to learn from us, someone will bite at your institution.
Yeah, and I mean, if I'll jump on that, what I'll also say is that orthopedics only has 1.8% Black attendings. So it's 98% not Black. So that means that whether it's residency, fellowship, attendingship, you're working with people who absolutely do not look like you. And so you will have to find, and all of you have to do this, is a base of how you can connect and reach out, right? I don't care how you do it. You need to make sure, especially if you have a home program, that your home program likes you and will rank you to match. because that is your best shot. They've seen you for 4 years, right? Other programs where you go rotate, they might really love you, but they don't know you for 4 years. You might bump down on the list, right? So you want to be as high on everybody's list as possible. You want that home program to love you. I would start out by trying to find out where you connect with these people, even though they are different, if that makes sense. And it doesn't have to be forced, but if there's a sense that you're way more comfortable with a certain group of people, which is fine. A lot of us are like that. That was why I picked Yale as my residency. But the fact of the matter is, a lot of orthopedics is not like us. I'm not quoting Kendrick. I'm more of a Drake guy, but it's the reality.
I love
I would
that.
say really quick, I know you want to move on or something, but Amani, just make sure you're confident going through the whole process. Like everyone already said, we are going to be notably different than a majority of the people in ortho. We have different experiences, different perspectives in life. But we're actually in a time where a lot of people do appreciate that. So whatever it is you do that's different, like whether it's like music or activities you do outside of work, like make sure you know those things well, because somebody might present you with the opportunity to talk about yourself and what you enjoy doing, even though it's so markedly different than what they do. I remember when I showed up on the sub-I for the place I ended up matching at, they had all the sub-Is go to the front, and one of the questions was, tell us your favorite Taylor Swift song. I'm like, bro, I don't listen to Taylor Swift at all. And I thought, to me, for a second, I was like, oh, it's going to kill me because it's going to seem like I'm not the type of person who would fit in with this program. I don't listen to Taylor Swift. I don't golf, whatever. But I think people just want to see someone who's confident and someone who, like Dr. Ibe said, can find some kind of common ground and not necessarily be anti. So just be confident in yourself. I think you'll be good.
That's awesome. I love that. I know we have some good questions in the chat here that we're going to touch on. I know Antonio had his hand raised for a minute, so we'll answer his question first, and then we'll go to the questions in the chat.
Yeah, thank you. I wanted to ask a question from a couple of different frameworks. Can you talk about the difference between community versus academic programs in terms of what that means for what qualities they look for in a resident distinctly, how you can tell the difference between the resources they might have, and then what that might mean for your career trajectory in terms of fellowship, lifestyle, geographic preference?
That's a great question. Really is.
It's a way to look at it. Most programs become very blended these days, but the community programs will often be smaller, right? Than the more very academic programs. Usually have larger residency groups. So if you're someone, you have to figure out what kind of person you are. Are you someone who works well with no matter who it is, no matter how big the group is? So usually the community program's smaller, they're usually leaner, right? So might be a little busier of a program, whereas the bigger programs, you can disappear a bit. Everyone might not be on par at the end of the residency because it's so large and it's easy to sort of hide. So what are some of the things that match with your personality, right? I think that's the way to discern that, because those programs will have things to offer. In terms of fellowships, you can come from any orthopedic program as long as you put together a good CV and get a solid fellowship, right? And so I don't think there's much in the way of changing your career trajectory. You just want to get into an orthopedic program that supports you and that you do well in.
Yeah, to that point, the fellowship process is much different in terms of stress level from the residency process. And as far as the difference between community and academics, then there's a middle ground. I came from a program of private-demics. So meaning that we had a bunch of private practices at a community hospital with an academic residency. You don't get any more blended than that. So I had a hospital that was literally in the heart of Paterson, New Jersey. And if you know anything about it, there was a lot of things going on there. So we were very busy. in terms of the ER and the trauma side of things. But then you had the private side where all the elective cases would go, where all my robotic cases would go. So it really does blend together after a, you know, after a while, and it's very, I would say, like, and you probably back me up on this after eBay, it becomes more and more harder to find something purely community, purely academic, or something along those lines. It seems like everything gets the lines get more and more blurry as time goes on.
Absolutely. And honestly, so most people in orthopedics don't do academics. So majority of orthopedic surgeons are not in academics. So it's always good to have programs that give you that community feel, that private practice experience, because that's what a majority of orthopedists do. Probably 80%, not more, go into private practice. And so figuring out what works best for you, trying to find programs that have a blend of experience, I think is, be valuable depending. If you're at the Mayo Clinic, I mean, you have a chance to go to the Mayo Clinic, you go, it's a great academic center, all academic. I don't know if you guys get a private experience there, JR, if you want to do a plug for your program.
So we don't actually have that much. It is like probably leaning more towards a lot of academic kind of side of things. We're a really large program. We have 12 residents per class. So like similar, like to Dr. Ibe said, like the larger academic programs. And so, but one thing that I think that even some of these larger academic centers are trying to do to give people like a community kind of feel, like Dr. Pierce and Dr. Ibe are mentioning, and that Mayo is starting to do, is offer like almost like away rotations during residency. So we're able to go to like Gillette for our peds, which is like in Minneapolis, and we can do trauma at Shock Trauma in Baltimore. So, people who want to have different kind of experiences, these academic centers are also recognizing the benefit of that. So I do think that, if you want to be the, like, I don't know, the chair at like a Mayo Clinic or something like that, doing like residency at like that program may be beneficial for your career progression in that sense. If you already, but like, I think 99% of people probably can't look that far and will know what they want that far in advance. And I think going to almost any residency at this point and doing well there and building a strong reputation of being somebody who works hard and does well, again, like ortho is small, you'll be able to take that and capitalize on it however you want to and kind of move however you want to. But still definitely recommend Mayo for a subtle plug. Most Black people in a single class ever this year, 5. So
that was a great question. So we'll move to the chat. Some really good questions here. Would you be able to speak about the selecting, preparing for sub-Is? And then that question came from Court. And then Brian came up and followed up with, would you mind touching on what you prioritized when you chose your away rotation sites, geographic preferences, quality of program, and what it may be? So love for you all to speak on that.
I can start. Oh, no, go ahead.
Oh, I could be super quick since I just kind of did it last year. For me, I knew that I was like interested in academics. So I was thinking of academic centers for where I would rotate. I know we just talked about this kind of dichotomy with that and that there's a lot of blendedness with that. But and I also looked to rotate at places where I had kind of connections. And so I went to Duke undergrad and I rotated at Duke. I had like a knee surgery at Duke. I ran track there and connected with my old surgeon and actually spent 2 weeks on his service. And so that was something that, I found that a lot of people I don't think to do, is to rotate at places where either you have direct connections or your mentors at your home institution have connections, because it just goes into that kind of thing of, if you can walk into a setting with somebody already kind of on your side and rooting for you, there's benefit to that. And so I'm at Mayo in the Midwest, so I went to a place in the South, and then I went to HSS in the Northeast. So I kind of tried to do a geographic spread because I think that I think at this point the data is is showing that you don't want to try to narrow yourself into a small kind of thing. When you're playing at ERS, they have like, you have geographic preference, and most people are saying say no, or like those kind of things. And if you can build connections in a broad way, it's basically your opportunity to cast a wide net. And so that was one thing that I thought about. I know some people who are like from California will want to do like away rotations at like UCLA, San Fran, and USC or something like that. And that can be that can be challenging, and that could close doors, because one thing that I saw a lot of is during interview season. I don't know if this is actually like a question that people are supposed to ask, but I probably got it asked to me every single question, every single interview, which is like, oh, where did you do your aways? And, that kind of thing. And, if you're just like all California and you just so happen to be like, I don't know, in Chicago or something else, that may subtly tell somebody that you're not really trying to get out of California. So that's just something that I considered. I know that people have different kind of preferences with your geography. And if you are like, you have to be in a certain location, then you can, try to make it kind of guide your away rotations in that way. But I highly recommend, like with ortho, because it's so competitive, giving yourself the best shot in casting the net like as wide as possible was something that I found to be beneficial. And then using the connections and the network that you have to be able to go to places where you'll be able to have resident support, faculty support, connections already that will be able to kind of, I think those would be fruitful connections for you when you actually land at those away rotations.
Yeah, so yeah, absolutely. There are things that give you a leg up and increases your chances of matching somewhere, right? In no particular order is if they have people that look like you. That's one. If someone from your medical school is matched there recently, all right, that's a big thing. And if they're doing well, usually that already opens the door. And so if I guess Charles Drew's a new program, but most programs already should have a post-match survey. They should have documents from where everyone is matched for at least 4 or 5 years prior to where you've been. You need to see that document. Who's taking our medical students? Because they're more likely to take you, right? Who do your faculty know? Or your mentors. You should not be applying for a ways. Well, you can do whatever you want, but if you want to increase your chances, it's better if you said, oh, I'm thinking, you tell your mentor or your program director, whoever it is at your site, I'm thinking of this 4 programs, or I'm between these 2 programs. Which one do you think? And we're like, oh, I know this person at X, go to this place instead, because when they write you a letter of rec and it's their friend reading on the other end, you're getting an interview, right? And so these are things to do to increase your odds. So just don't do it random. I would want you to have somebody else look at your list when you're considering, applying for the aways, and look at your post-match surveys.
No, Dr. Howard, you had something to share.
Yeah, I guess not like a ton more for me personally. There's a lot that went into that decision. I think you guys should treat it the same. It's a very important, 2 to 3 to 4 for some of you guys away rotations. At the time that I applied, which again is forever ago, OrthoGate was a huge website. I don't think people post as much on it anymore, but that was my starting point. And I read through literally every single review of every single residency program in the country. Kind of put together a list of where people had universally good experiences at their residency programs. And that's kind of where I started. If there was anywhere that didn't have a positive review, that place automatically was somewhere I was not going to try to rotate, because it's going to be 5 years of your life. You don't want to spend 5 years unhappy. So that was a starting point. Then number 2 for me was I wanted to get different types of experiences. I wanted to rotate at a blue collar program, somewhere that's going to be super trauma heavy, where I felt like I was going to get my hands dirty from the beginning. I wanted that kind of academic feel, and then something in between. I also wanted different regions of the country as well, so I tried to spread mine out as well. Even though I was from Jersey, I knew I wanted to kind of do something different and go somewhere else. So I tried to spread things out. So all 3 of those things factored in. And then you can look at demographics as well. Like Dr. Ibe said, I think it helps to rotate places that have minority individuals there. But there were a couple great institutions that, that I got interviews at that had Black individuals or minority individuals, but their patient population they were serving was not one that had many minorities in it. So that was another thing that factored into me. So those are just some of my things. There's other stuff that goes into it too, but I think it's actually an extremely important decision where you choose to rotate, because that could be where you end up taking your job. And for most people, it is where you end up taking your job.
I love it. Great question there. I know we have one in the chat, and I know we have about 2 more minutes left. So we'll sort of wrap up after this question and open it up for any final questions. But what are some things that might be viewed as a red flag in an orthopedic application, other than the common things like remediation and low step?
I am of the belief that, you know, the biggest red flags can sometimes be quite subtle. For example, if you have letter writers, the reason I went to my letter writers and would always say, would you be willing to write me an outstanding letter of recommendation, is because I wanted to make sure that they were going to talk about me like I was the best thing since sliced bread. That letter writers that, and I thank you, Dr. Howard, for putting that in there. Letter writers who make it sound like he's all right, you all right. You know, that's might as well just be a thumbs down. That puts everybody on edge a little bit. And there are obviously the big ones like the bad grades and the bad steps. If you and again, if you had a bad experience with somebody in this world, it is a small world, unfortunately, and we talk. And even if you had a bad experience with someone who isn't even faculty at a hospital, it will still come back. You may have had a bad experience with the person at the front desk, and you may not know they play golf with the chairman. You know, that is how critical each interaction is. Being mindful of interactions and mindful of the letters of record are kind of those are the things that can be the downfalls.
Wow, yeah, man. There are definitely a number of people every year where the scrub techs are like, hey, they can't come here. You're like, I thought they were okay. Nah, when you guys stepped away, they were rude. They didn't listen to my recommendations when I told them how you like to do stuff. Yeah, so it makes it stressful. It's a stressful period already, but it makes it more stressful to realize that you're always under a microscope. So like no sulking, put a smile on your face, always say yes, thank you, right? All the time. Try to, be professional when you interact with people, because everybody is paying attention. And really, it's just so you don't make any mistakes. And what that does, it doesn't close any doors. But if you make any big mistakes, doors shut. And it becomes very hard to match in a specialty where 60%, and then the year prior, 50-something% of people match. So extremely competitive. You want to put your best foot forward. And you definitely want to pay attention that everyone's watching.
And to piggyback off that, because Dr. Ibe, what he just said, jogged my memory. There's a book about getting into ortho by guys at NYU, and the only thing I remember it was a great book overall, but the biggest thing I remember from the book, I should say, is that there's 3 A's, which you might have heard before, that are important in general in life and definitely for this process. So affability, availability, and then ability. So the affability is kind of what Dr. Ibe just mentioned. It doesn't matter how much rotations suck or how much classes suck, whatever, you want to have the reputation as being that guy or girl who is just always happy, loves ortho, always wants to be around, and is always motivated to get things done. But availability, mentioning red flags, that is a huge thing. So you don't ever want to be late, not once ever, for anything. It only takes one time for you to mess up and for someone to say that person can't come here because they can't be trusted. So always make sure you're on time. And it's not just a matter of showing up when you start rotations. I've seen it people have bad impressions of people who even don't respond to emails promptly. If you are asking attending for help or for them to mentor you, whatever, and they say, hey, can you do this for me? Send me a CV, whatever, and you take a month, like that person's trying to give their time to you to help you out. So just make sure you're prompt with everything. So I would say make sure you're always available on time and early for anything that you can be.
We have some gems in the chat, so make sure you're taking a look at the chat if you haven't done so already. I know we're 3 minutes over the top of the hour. I don't know about you all, but this is an action-packed and very valuable session. As we close, I'd love for the panelists to just share, you know, any way that the group can get in touch with them, anything they want to plug in to really help the group continue and positioning themselves after this session, and how to get in touch with you all.
Well, I'll certainly put my email in here, and you know, and one thing about when we give you our email and our contact info, if you're thinking, oh, I don't know, I don't want to bother them, I have given you the key to bother me. If I didn't want to be bothered, I would not provide the contact information. So please, please do not be shy about emailing us. If it takes us a day or two to get back to you, somebody's knee exploded, somebody's reducing something in the ER, like JR, you know, like just be patient with us. But, you know, but I promise you, you know, we are leaving ourselves available to you. So by all means, make use of this contact info.
Yeah, email JR. He's not busy. The trauma list is only 20 people. Only 20 they are posting about 20 patients on the trauma list.
First of all, it's gen surge trauma is what I'm on right now. So that is a whole different thing.
Oh yeah. The push the belly, push the belly.
Yeah.
You know, retract belly fat. Yep. I mean, you'll be retracting ass when you get to on your hip rotation. So
any final words, last messages to the group from the panel?
Man, I'm happy to see you all. Right now there's so much information about getting into orthopedics that I almost feel like there's no excuse for you to not have your best foot forward when you apply, especially now being in a position where I'm reviewing the applications. I'm, you know, making sure our rank list is in order. You know, it makes me sad if we have people who are applying, they didn't go through any sort of interview prep, any mock interviews. They didn't have anyone review their personal statement. They send in things with errors. All these things would do you in, right? And so there's so much information now. Run it through somebody, whether there's anyone on this panel, somebody you know. What do you think about this? What does it look like? More than ever, you're set up with an opportunity to match into the field. And I think that you all should try your best to make the fullest of that and take the fullest of it, take the whole opportunity. And that's what I think.
Awesome. If that's all we have, thank you, everyone. Come off, give a round of applause, a big thank you in the chat. Come off mute if you want, to the panelists for their time and their expertise today. You know, we appreciate you all taking the time to join, and we are here to support you, right? So feel free to reach out, and thank you all for coming. Enjoy the rest of your evening.
Thank you so much, guys, for taking the time.
Thank you so much.
You're very welcome.
Appreciate it.
Thank you for having us.
Thank you.
Yeah. Take care, guys.
Thanks, everyone.
Appreciate you guys.
Hey, JR, you're everywhere, man. Supposed to be working.
Hey, I really am. I don't know. I mean,
Isn't there just a radius downstairs you need to take care of?